also submit written testimony by emailing ccc.health@boston.gov. Today's hearing is on docket number 0729, message in order authorizing the city of Boston to accept and expend reimbursements up to the amount of $10 million from the Federal Emergency Agency, FEMA, and the Commonwealth of Massachusetts for expenses related to the COVID-19 pandemic. Joining us today is Justin Stair, the budget director for the city of Boston. And so with that, I think to keep this moving along, I'm going to just jump right into my questions. If any counselor has to go and would like to go on record before they leave, just raise your hand. I do believe this will be pretty brief. After I ask my questions, I'll go in order of appearance, which was Councillor Flynn, then Councillor Braden. And so are you with us, Justin?
Yeah, I'm here. Can you hear me?
Yep, can hear you great. Could you just provide us with a breakdown of the costs that amount to 10 million?
Yeah, so Councillor, if it's okay with you, I have a very brief deck I can fly through that hopefully answers some of the questions.
That's fine. That's great.
Okay, so I'm going to share my screen. Is that coming through?
Yep, perfect. I see it.
Great. Awesome. So I will try to be brief and try to get to the questions, but thank you for having me here, Councillor. I'm just going to go quickly over the FEMA funding and talk a little bit about where we're coming from. As you guys all know, FEMA represents the Federal Emergency Management Agency. They're responsible for coordinating all the major disasters. On March 27th, the FEMA declared a major disaster for the Commonwealth of Massachusetts, including Boston. What that means is that as part of the major disaster declaration, it authorizes Category B emergency protective measures to become available for local municipalities to protect the health and safety of residents. The way we work is we work through MEMA, which is the state Massachusetts Emergency Management Agency, in coordination with FEMA. And that helps us access the public assistance grants, which is the grant that we have in front of you today. On public assistance grants, these are the types of grant. This is the grant that we're applying for, or the reimbursement that we're applying for. This is to provide financial assistance to local cities and towns during the disaster. As many of you know, FEMA provides 75% of the eligible costs, where the locality, or in this case, Boston, is responsible for 25% of the costs. Just one thing to note is FEMA will not duplicate other resources that we receive. So if we get federal money from the Department of Health and Human Services for something like Medicaid or Medicare, or if we're receiving federal money like CDBG or ESG funding for housing, we can't get twice the funding for both getting MEMA and that federal resource. And because this is a pretty unique grant that we're experiencing right now, because normally when we get FEMA reimbursement, it's for a very set incident like a snowstorm, or unfortunately in the case of the marathon bombing, where there was a sort of a start, a middle, and an end to it. COVID is obviously a continuing disaster that we're dealing with. So we're going to have multiple iterations of requests for funding, and we will be back in front of the council probably several more times over the coming months and years, frankly, to seek additional authorization to get more reimbursement. Just quickly touching on the types of costs that are eligible under Category B, which is the type of work that we'll be pursuing. So the types of eligible costs include emergency operations, technical assistance, disinfecting public spaces like City Hall and BCYF centers that are actively used for food distribution, emergency medical care, sheltering, including non-congregate shelters like Boston Hope, supplies, including medical supplies, PPE, and other consumables, communication, so getting information out to the public, and then finally security for any of those areas. Just to give you a little bit of a high level on where we are in the reimbursement process right now. So as of right now, we have submitted our request to become a public applicant, and that is that red check mark right there. Right now, we are gathering our materials to submit to FEMA. One of the things which makes it a little bit difficult to tell you exactly what the reimbursement is going to be used for is that FEMA is done on a reimbursement basis. So we are submitting costs to FEMA, and they will then either approve or deny certain things depending on whether it's an eligible cost or not. So we will be preparing a couple different projects, which I'll get into in a second, to submit to FEMA for this initial part of money. But we know that it's an ongoing process, and there'll be a lot of back and forth with MEMA and FEMA over the next couple months and years to make sure we're getting the eligible costs. So the next steps from here is we will be submitting our COVID-19 documents to MEMA for their review. One thing that makes this a little bit different right now is that MEMA is assigned a statewide accounting team to work with Boston to collect all of our information, because there's a lot of different areas that we are investing in that we're hoping to get FEMA reimbursement for. So on the initial request that we're submitting to FEMA, these are the sort of the first projects. And as I mentioned, these are ongoing things. So we're basically trying to set aside certain amounts of funding that we can start to go get right now. The projects that we're going to be submitting for initially are emergency shelter costs. So this includes Boston Hope, which, as many of you know, is a 500-person respite shelter for our homeless population, as well as a 500-bed hospital that MGH and the state stood up for medical care. We were responsible for the Boston Hope, the homeless shelter side of it, which included work with Boston Healthcare for the homeless and others to stand up a medical respite facility for COVID positive homeless folks to recover and ultimately be discharged healthy, which we were able to stand up. Other expenses we anticipate filing for our personal protective equipment for our public safety officers, as well as BPS and other frontline city departments. Disinfecting public facilities. So I mentioned that City Hall, some schools and some BCYF centers have remained open for food distribution. As many of you know, they have required intensive cleaning since the beginning of COVID-19, which makes it an eligible cost. And then finally, the Emergency Operations Center we have in the city of Boston, which coordinates the city's response to COVID-19, as well as coordinating amongst other sister agencies like DPHC in schools and others. So those are the types of costs that we are planning on submitting to FEMA. Again, we are anticipating at least $10 million in the first tranche of money, and we'll be back in front of the council in the coming months once we get our first submittal approved to potentially seek further reimbursement. So I'll stop there, and I'm happy to take any questions, Councilor.
That was perfect. That answered all my questions. And so I'm just going to go down the line really quick and see if anybody has questions, beginning with Councilor Flynn. It's by order of appearance. Councilor Flynn, do you have any statements or any opening questions? I'm going to go past that. Councilor Braden.
Thank you. The explanations were very clear. It helped me get a handle on what all the money is spent. And my only question is, do they anticipate any hurdles in the reimbursement process? Any glitches or hurdles that may restrict our ability to be reimbursed?
It's a great question, Councillor. I think we are very comfortable with the normal FEMA process. We access FEMA probably every other year for snowstorms based on the winter. I would say everyone is learning a little bit as we go here. This is the first time that reimbursement has ever been used for this type of public health emergency. So I think it is it's all going to be a little bit of a learning process, but we are blessed in Boston to have a staff, including Linda Fraley, who is our director of risk finance, who has worked with FEMA over the last couple of years, and that's certainly a benefit to have. But I think it's going to be an ongoing discussion with FEMA and MEMA.
That's very good. That's all the questions I had. Really, that was the only concern I had. If we expended money that we weren't going to get reimbursed. Councillor Arroyo, I have to jump off and leave now. So thank you for chairing.
Thank you. Councillor Flaherty is here. And so Councillor Flaherty, if you have any statements or questions.
Yes, good afternoon, and thank you, Councillor Arroyo, for chairing, and also for Justin and the administration for joining to explain the funding. Just a couple of areas. Do we anticipate receiving any additional funding from FEMA or the state to reimburse us for COVID-19? And will the funding adequately cover the expenses that we've incurred as a result of COVID-19? And lastly, are there any private sources or any other type of grants out there available that we could also be applying for additional relief? That's it for me, Mr. Chairman. If Justin could answer those, and then I'll stand by. Thank you.
Absolutely. So I think we definitely anticipate applying to FEMA several times. I think this is the first tranche of funding because we've spent about $10 million through the Boston Hope and PPE so far in the past 2 or 3 months. So I think that this is the first of probably several applications to FEMA for funding, and we will be back in front of the council to accept those or sort of go through that grant process with you folks, and we'll certainly have more to add at that time. I think the Coronavirus Relief Fund or the CARES Act funding that the council approved a couple weeks ago is certainly the other big pot of money that we are accessing to do a lot of the work that we've talked about, whether it's in schools or some of our small business relief funds or some of the other food access work that we're working on. Those are the two big pots of money. I think the Resiliency Fund is also a resource that was stood up on the private side or on the sort of the nonprofit charity side, which I know that a lot of folks and a lot of nonprofits in the community continue to access. So I think between those three, I think we'll be in pretty good shape. I think we're always on the lookout for additional grants, and we would never leave a stone unturned. So if anyone has additional opportunities that we may be missing, I'm happy to hear it and happy to try to get the applications out for that.
Very good. Thank you. Thank you, Justin. Thank you, Mr. Chair. And obviously, I'll be voting in support of it when the chair puts it forward for a vote. Thank you.
Just really quickly, either Justin or Neil, is it possible, because we've been added, Council President Janey has joined us, as has Councillor Edwards and Councillor Bach. Is it possible for them to receive the slide deck that you showed at the beginning of this? Is it possible to email that? And then Councillor OMalley has also joined us. Sorry for the way the boxes are set up. But is it possible for that slide deck to be emailed to them, or just to all the councillors in general?
Yeah, we'll send that.
I will circulate the draft now for the deck now.
Appreciate it. Councillor Flynn, I know that you froze before you could ask any questions, but you were the first one here. So Councillor Flynn, if you have any questions or comments.
Yes, thank you, Councillor Royal. Thank you for your leadership on this important issue. Thank you to Justin. Justin, I just wanted to follow the grant itself. The grant goes from FEMA, the federal agency, to MEMA, which is the state agency. And then it goes to what department in Boston? I'm sorry.
So it's accepted as a grant either through the Office of Emergency Management or through just the ANF, the budget department. And we will then transfer those costs that we've incurred in those different departments. So like a good example is the PPE, we bought it through central procurement in the city. And then once we receive the federal reimbursement, we will shift those costs out of central procurement over onto the FEMA grant. So because it's a reimbursement based, the costs are right now being incurred in a whole bunch of different departments. And the ultimate funding will come back, as you said, from FEMA to MEMA to us. And then we will shift those costs back over to away from those other city departments where they were originally incurred.
So when it goes into the city department, MEMA, how do they interact with other city departments to ensure what we need or what they've been working on? Does the city of Boston MEMA track progress during COVID-19?
Yeah, absolutely. So there's a concentrated effort amongst the Emergency Operations Center, the EOC, which is run by MEMA, by the Emergency Management Agency for the city, to manage the actual work and the actual implementation of all the different priorities that we've had over the last couple of months. I would say my office and the ANF cabinet writ large, whether it's auditing or purchasing or treasury, we really manage the accounting side of things. So basically, as the FEMA grant comes back, we have identified costs associated with COVID in each of the different departments that are incurring it. So whether it's PPE or Boston Hope or whatever, cost that it may be, we will then attribute those costs to the FEMA grant because it's reimbursement based. So we only get reimbursed by the federal government once we've demonstrated that we have spent the money already. So that's why this is, that's why it's a reimbursement grant, and it comes to a central location, which we then sort of attribute just cost to it, not new programs.
Yeah, my question, I understand that. My question is, I'm going to vote in favor of this, obviously, $10 million, but I would like to get some information from MEMA, the City of Boston, MEMA, the technical people, not the budget or accounting part, but the technical people, just on lessons learned maybe, or what went well, or what challenges we got, logistics issue. I studied this in the military and worked on this in the military, but you know, can you give us a little bit of background on the City of Boston MEMA department?
Yeah, absolutely. I would certainly defer a lot of the questions that you're asking on the logistics and operations sides to Chief Benford and the entire EOC team. But I'm sure that they would be happy to come and talk to you. All I can say is that it's been a Herculean task to bring together all city departments and frankly many quasis in coordination with both the Public Health Commission and then hospitals generally to manage the city's response to COVID-19. And I think that there are certainly some lessons learned, and I'm sure that there are some takeaways from logistics point of view, things we found along the way. But I would have to defer to them on the specifics of that. But other than to say that I think the city has really come together. Every department is focused on COVID. Every department is focused on responding to it. How do we shift operations? How do we deliver services in a COVID-19 world? How do we get PPE to frontline departments? It is a daily occurrence that we are working on that. So I think it's probably a little bit bigger than this pure discussion. And I certainly would want Chief Benford and the rest of the EOC and other folks who are responding to it to provide the expertise on the ground. But suffices to say that there's certainly a lot of work that has gone into it.
No, I know that. Yeah, but I'm voting for it. But I also would like to learn about the department itself. I was active during the Haiti earthquake. I was off the coast of Haiti during the earthquake. I was in Guantanamo at the time and helped on logistics and supplies going into Port-au-Prince. But I would like to learn more about about MEMA for the City of Boston.
Yeah, absolutely.
Thank you. Thank you, Councilor Royal.
Thank you, Councilor Flynn. And so I'm going to do my best at this point. So we've been joined by Councilor Bach and Councilor Sabi George. I'm waiting for central staff to tell me the order of arrival for some of these last ones when you don't add folks in and then you just look and there's a bunch of names at the same time. I don't know who came first. But I do know that Councilor Janey, Council President Janey is next, followed by Councilor OMalley, just to put folks on notice.
Thank you so much, Mr. Chair. Can you hear me okay?
Yes.
Okay, wonderful. And thank you to the panel. Can't quite see who's in the room. I think I recognize some of the voices. Thank you. So we're talking about $10 million from FEMA. And I missed the slide deck, and I still didn't receive it in my email. Oh, yes, I did. I just got it. Thank you, Neil. I guess my questions, I'm really interested in understanding how we deal with disproportionate impact when we're talking about these resources. So one of the things that we understand from all of the data, from all of our briefings, our daily briefings with the mayor and his team and all the work that people are doing, that there is disproportionate impact, particularly in the Black community. When you look at the population in Boston and you look at who's impacted when we're talking about confirmed cases as well as deaths. So my questions are really around the disproportionate impact and how we prioritize targeting resources to those most in need.
Hey, Councilor, this is Justin Stair. Great question. I'll do my best to answer, and certainly we want to defer to Marty Martinez, the Chief of Health and Human Services, who has coordinated this response, in addition to the Health Equities Task Force and some of the work that they've been doing. But in short, so this grant is really a reimbursement for costs that we've already been expending over the last 3 months. So one of the things we mentioned before was that this is going towards some of those big ticket FEMA eligible items, like standing up Boston Hope, which was, as we mentioned, the 500 person homeless shelter that the city stood up in conjunction with the state and Partners Healthcare to fund the medical respite for COVID positive homeless individuals. It also goes towards PPE for frontline employees. So over the last 3 months, a lot of frontline employees, as well as both our folks doing food delivery, as well as our schools, have been still out, performing their duties heroically in the COVID time and sort of putting themselves at risk. So we've needed to provide them with adequate PPE to continue to do a lot of the on-the-ground work that every department is doing.
Thank you, Justin. I have a clarifying question on that piece, if you don't
Yeah,
mind.
go ahead.
Thank you so much. So on the PPE, I'm interested when you say frontline workers, who you mean. So that's just one question. And then with PPE, was it just limited to frontline workers, or was this also the PPE that we've been trying to get out to the broader community in terms of our senior centers and other places where we've been trying to target vulnerable populations?
So the FEMA reimbursement is limited to what we have been providing to frontline employees. And by frontline employees, I mean our public safety officials. So EMS, fire, police, certainly our sort of the broad spectrum of both workers and volunteers who have been delivering, tens of thousands of meals a day to residents in Boston. Any other
through the city, through an initiative of the city. So if someone is doing meal delivery to school children as a volunteer, not a city employee, they too would have received the PPE through this grant. Yes?
Yep.
Okay. Yeah, so I guess, I understand that it has limitations because it comes with certain requirements and criteria. My question still remains as we try to tackle this, as we try to respond, and I know the work that people are doing. I've been on the calls and I'm very grateful for the work that the city is doing, but my question still remains, if not this grant, just overall, I'm really interested in how we have a targeted, intentional approach for those most in need, looking at disproportionate impact. And while there may have been limitations with this grant, I think that is the question that I just want to be elevated in all of our conversations as we move forward.
Yeah, just the only thing I would add quickly, Councillor, is that part of this grant as well is the coordination we've done around public communication, and that's a lot of work we've done to both get information out to the public in written and digital form, but also standing up text message alerts in 7 languages and all of the different types of work we've done. That is a FEMA eligible cost that we.
Excellent. Would it also cover paying for interpreters or just the printed materials being translated?
So if depending on the situation, when and if a interpreter has been used or needs to be used, and it's communicating sort of COVID related, that's the other thing about it.
Yeah, so it could be used for that. Yes.
If it was communicating COVID related,
Yes, obviously. Yes. No, that's helpful. So and I just have a few more. Thank you so much.
Yes.
On the language piece, how many languages were we able to get it out and in real time? That has been a concern that many of my colleagues have raised. Great that we are translating, but if we're not doing it in real time or releasing information all at once, it puts certain groups at a disadvantage. Were we able to improve upon that with this grant? Yeah,
so we put out the daily text messages. I believe they're daily in 7 different languages. I can get you the exact languages that we put them out in. But that is a real-time thing that we're able to do in addition to all of the written materials that go out and all the updates that the mayor has are normally translated anyways. But I can certainly get you the seven languages that we are able to.
Yep. And then in terms of the materials, and again, I'm wrapping up. I don't see a gavel or a clock or chime or whatever. So Mr. Chair, please interject if you need. So in terms of making sure that, again, we're getting things directly. So if there are materials in different languages, that means we're trying to get that to somebody's hands. How are we, again, prioritizing communities most in need? What's the strategy for getting the material for those who may be less connected to the internet, who may be less likely to be tuned in to maybe the local news, maybe they're watching CNN, the national stuff. Maybe there may be, obviously language barriers. We're talking about language access here. How did we target? Because I've raised this because I worry about an approach that it casts the net wide and kind of just hopes for the best, an approach that is, the rising tide lifts all boats. In my experience, the rising tide will sink people who don't have boats. And that's what we're talking about here. And so I'm just looking for that intention and that targeted approach to those communities. If you could speak to that in terms of the materials.
Yeah, absolutely. I think certainly at the height of the COVID-19 surge that we had several literature drops in every neighborhood where we would go door to door to every city every.
Yep, I helped on those. Exactly. Yes.
Yep. So that one, as well as sending out the communication vehicles to also get the message out there. I think it is certainly a focus of the Health and Equities Task Force, which is help elevating some of the work that we're delivering across the board. And I think that there's certainly intentionality with getting to communities most affected by COVID-19. We are through the Boston Public Health Commission sending in nurses and doctors and supports and other PPE to BHA housing, to assisted living facilities, to senior centers. And I think that there is a real intentionality to dedicate as many resources to those types of those residents and those folks most affected by it as part of our overall response, coming from a lot of different resources. Some of it may be FEMA, some of it may be CARES Act, some of it may be other resources that we've identified. And I think it is really a whole approach, and FEMA is really just one of our tools in our tool belt to help fund it.
Yes, thank you so much. I'm grateful that we have these resources. We certainly need it. And I'm grateful for the work that folks are doing. I know we're short on time here, so I want to let the chair get to my other colleagues. If I have additional questions in the second round after reviewing the PowerPoint, I'll indicate with the blue hand. Thank you, Mr. Chair, and thank you again to the panel.
Thank you so much, President Janey. So I thank you, Central Staff, for sending over the list of folks in the order of appearance. And so just to be clear, next will be Councillor OMalley, followed by Councillor Bach, followed by Councillor Asabi George, followed by Councillor Mejia. And if you need a second round for whatever reason, raise the blue hand. And with that, I'm going to turn it over to Councillor OMalley.
Thank you, Mr. Chairman, and good afternoon, Justin and colleagues. Appreciate your good work. I was a little bit late, so I'm just reviewing the slide deck now. But Justin, is this money part of the $2.7 billion Massachusetts aid we got in late April?
No, so this is separate. It's a good question, Councilor. This is separate. So this is all prospective FEMA reimbursement. So we basically have identified at least $10 million worth of costs that we're going to be submitting to the feds that we will hopefully get reimbursement for. So this is a separate pot of money.
Got you. And this is the first time we're going through the reimbursement process. The other was more proscriptive, correct?
Exactly.
As it relates to COVID-19. And I guess, is there any sort of past as prologue in terms of how long the reimbursement process may take?
Yeah, it's a great question. I think one of the pieces of the slide that probably leave a little bit to be desired is the fact that when we actually submit the work to FEMA for their approval, it's a little bit of a black box where we may not know for 3 to 6 months when we will be getting it, but we will still be submitting additional requests even if we are waiting for this initial one.
Great. Okay. No, I think that's fair. That was one of my questions. In terms of the PPE and supplies, how are we? I mean, recognizing the fact that it's going to be needed for months and months and months in the future. How are we looking at sort of our PPE supplies for staff and city workers, as well as those that we've been able to give to the public?
Knock on wood, right now, we are in a very good position. I think it's a testament to both the EOC, but then also Kevin Coyne in purchasing, who has done yeoman's work to source PPE from many, many different sources, calling around, literally dialing the entire weekend sometimes, just trying to find sources. So we feel like we're in a good position right now. All that being said, we always need more, and we're continuing to source more, especially if we, as many public health officials predict, we are facing a second surge sometime in the fall.
Yeah, no, absolutely. And thank you. I'd also like to echo Kevin Coyne's great work here. It is, the abandonment that the federal government not only left to the states, but the local governments as well, in terms of preparation and stockpiling many of these important resources is contemptible, in my opinion. So it's really been up to local governments and state governments to scrounge for themselves, and appreciate Kevin's great work and your great work as well, and your other colleagues. And then finally when we talk about disinfecting, are we doing that in, some city buildings, schools, obviously is going to be a big push. Are we doing that in-house, or are we contracting out with any firms?
I believe it's all done in-house. I will put a little caveat is I'd have to check with the schools and public health to see if they've got any contracts, but for the most part, it is done through existing city employees.
Gotcha. Okay, yeah, because I'm just curious if there's any procurement rules that are that are changed given the pandemic, given the state of emergency, in terms of if we were to have to contract out with a firm. It's really more of a curiosity, less relevant to this conversation. Obviously, I support this, appreciate your good work and appreciate the transparency. And thank you, Mr. Chair, for holding a very informative hearing. Thank you.
Thank you. And just really quick, I was told by central staff that for Justin, specifically for you, our city council panelists, our City of Boston panelists, the video was disabled when you started, but you should be able to enable video if you'd like now. And with that, I believe next is Councillor Bach.
Thank you, Councillor Arroyo. Yeah, Justin, I have a few questions. One is just how are we thinking about the source for the 25%? So I know like FEMA covers 75% of these expenses, and then I know there was some question about can you use your CARES Act money to help cover the 25%, or does it need to be separate, local revenue? Can you just talk a little bit about that?
Yeah, great question. The White House has put out guidance saying that CARES Act can be used for it. The state of Massachusetts has put out guidance that says that the coronavirus relief fund or the CARES Act funding can be used for the 25%. We are still waiting for final sign off from FEMA, but we are working under the impression that the CARES Act will be funding the 25% portion of our FEMA reimbursable costs.
Okay, great, awesome. And do we have a sense then, I mean, the amount of this CARES Act that we thought we could allocate to that would sort of determine, you'd multiply it by 4, and that would give you a ceiling on what we thought we could get, in terms of maximum FEMA. So what do we think that is?
It's less, right? So we're never going to be able to sort of fully, so we received $121 million of CARES Act funding. We're never going to be able to we're never going to spend $500 million worth of resources on responding to it. There's just not that many things that are eligible. I think that this is probably the first FEMA reimbursement we will seek. So if you were to add in 25% to this, it's 12.5. I think we will be back for potentially 1 or 2 more similar sized FEMA reimbursement grants over the next 6 months, depending on how long the pandemic lasts. But I think it's a little bit dependent on when FEMA turns off the spigot. So they have sort of continued the declaration of emergency from March until now, but it is still a month-by-month process with them where they could end the emergency declaration, and then that would sort of end our FEMA contribution or our FEMA reimbursement process. So as of right now, this is what we think we've expended as of a couple of weeks ago when we submitted this. And this is sort of what we think we will receive so far. And then we're going to continue to try to maximize it until they turn it off.
And when you say this, you mean 10 million? Sorry, what's the overall number?
So we've got a $10 million grant so far. We think that covers costs that we've accrued, or FEMA eligible costs that we've accrued from March until say mid-May when we submitted this to you all.
Okay.
I think that there will be similar sized grants that we will be submitting to you all in the coming months for future reimbursement.
Yeah, no, I got it. Yeah, no, I guess I was asking in the other direction. Like, obviously, we've got CARES Act money that we've committed in other ways, like to, like things. It seemed to me like there was a category of things, like for instance, supporting the youth summer jobs, and maybe some of the school stuff for the fall. Though I know it's all still TBD. That like we know we can use CARES for, but not FEMA. And so I'm just trying to judge like, is this a thing where we think we probably have about 25 million of CARES authority that we could turn into FEMA, like 25%? Like just kind of get a sense of scale.
Yeah, no, so I think it's smaller than that. I think we are looking at probably a total eligible cost from FEMA somewhere in the tens of millions of dollars, and that therefore the CARES Act portion of it would be 25% of it. We're not going to be accessing hundreds of millions of FEMA reimbursement. It's going to be more in the, for argument's sake, let's say we have 2 more $10 million ones, so maybe 30 million total. So 25% of that is about 6.5 million.
Got it. Okay, great. That's helpful. And then can you just speak to, well, one question I have is, am I right that like there's, there's some kind of process with FEMA where you get them to sort of approve a like category, like a project, sort of like something like Boston Hope is obviously now we've sort of done it and we're not continuing to do it. But my impression was that there's sort of an initial application where you get them to say like, yep, that's an eligible cost. That's a project we recognize, or like maybe you have a big feeding project and you say, and then you sort of have a ton of confidence about your reimbursements. And until you get that initial thing, you're depending on how on the edge it is, you're a little less sure. Is that right?
Yeah, that's right, Counselor. So for the most part, FEMA doesn't make you seek pre-approval for your costs. So if it's in the guidance and it seems like it's a life-saving or public health related measure, it's pretty straightforward. Because this is a very unique instance of the feds using FEMA for a public health crisis. They have added a few more hoops to jump through. The two I think the food one is a great example where the state actually goes and gets a blanket approval for the entire Commonwealth to deliver certain types of food programs, emergency feeding programs. Same with what they call non-congregate sheltering, or basically dorms or hotels and stuff that we have. Those are only given on a month-by-month basis. So that's where we have a little bit of risk in sort of trying to do new programs with this funding, is because it only gets approved on a month-by-month basis when we certainly know the demand is going to probably exceed that. So I think that there are two instances when it's food and non-congregate sheltering where there is a separate pre-approval process that the state has gone through. But for the most part, as long as it falls within the guidance, we feel pretty confident that we're going to get reimbursed for it.
Got it. And with the non-congregate sheltering, I know we had an initial conversation, I think when the CARES Act money came in, about, and I think it's in some ways more kind of a second wave thing, but one thing that folks in other places have started to do, or at least set up the capacity to do, is to create, shelter, like hotel type context for people who are not unhoused, right? But who live in really dense housing where it's impossible to self-isolate when they get COVID. Maybe intergenerational, they've got older folks. I know that it's, because one of the challenges, Chelsea has had some limited usage of this kind of thing. And I was just wondering where our thinking was on that.
Yeah, absolutely. So we're a little bit hamstrung by the approval that we get. Right now, it's only for vulnerable populations and COVID positive individuals. I think you're absolutely right. Certainly people who have been exposed, people who live with parent or family with comorbidities. Those are certainly areas that we know are in need. We are working through that with our public health commission. We're a little bit, it's probably not, unless they are COVID positive, we have a hard time
right.
housing.
I'm thinking more about the person who's COVID positive, but is housed, but densely housed.
Yeah, so the initial guidance was only for vulnerable individuals who are COVID positive. So that's why we were able to do the homeless shelters. We were able to set up stuff for first responders. So those two are certainly where we've been approved right now. A sort of general adults were not included in the state's emergency waiver for non-congregate sheltering, but we do recognize it's a need, and we do recognize that it is certainly something that will continue, especially if there's a second surge. And the Health Commission, along with the Department of Neighborhood Development, are looking at options like hotels to potentially access. We have not had the demand reach the level that I think would warrant a sort of a major city expense to either rent out a hotel or buy something, but we are trying to find identified solutions that make sense and can be scalable.
Yeah, no, I agree that it's not necessarily what we need right now, but I just think a lot about, folks housed in public housing, folks just housed in dense housing. And I would hate us to be in a situation. I've been thinking a lot about how it took us months to get the federal waiver to join the pilot to let people buy their groceries with SNAP online. And just trying to think about like, what are the things that if we worry about a second wave that we could like set up at least the precedent authority for, right, before we need them. So I don't know if there are conversations ongoing with the state about expanding that emergency waiver in that direction, but it seems to me like it would make a lot of sense.
Yeah, it's the state submits the emergency waiver to the feds, who then give us a month-by-month approval. So I think we've certainly had conversations with them about what we can and can't apply for, and I think it's certainly one of the ones we would love to access. I think it's because because it lends itself to a month-by-month process, and normally if we were going to enter in some sort of agreement to do that type of housing, it would have to be for a longer time period. We're trying to be mindful about identifying a stable resource that we know we can rely on for many months. And that's something we're working on. It's just we're still circling on what that looks like.
Okay. And then my last question is just related to food. Just if you could speak a little bit to like the types of food delivery that we now have authorization for, and whether there are any that we would like to, but we don't have authorization for, or that we're sort of pushing on, or that we're interpreting it to cover it. I'm just curious about, I know that the city's really been working on a lot of creative ways to get food to people, and that's really important to me. And so I just would love to hear a little bit more detail on that.
Yeah, absolutely. And I think nothing has jumped out more as a need. Well, I'm sure there are many things, but that has certainly jumped out as a need in recent months. We really think about food in three ways: the school age population, which is served through our summer meal program or our expanded site program that we have. So that is fortunately a self-sustaining model funded by the USDA through the school department. So that one is pretty set. Senior delivery, both for groceries and prepackaged meals or pre-made meals, is something that we are funding through a combination of existing federal resources through our Age Strong Commission, additional federal resources that have come through the Age Strong Commission, which I believe you may have had a hearing on or may have an order pending before you. In addition, seniors who are 65 plus and categorized as vulnerable do qualify for potential FEMA reimbursement. So we are looking at that as well. The other resource that has gone into that is the Boston Resiliency Fund, which is another area that has made significant contributions over the last 2 or 3 months to that area. The last bucket of types of food is really more of a general adult meal population, which we have also stood up using a combination of city and BRF resources. I think that is certainly one that we do not have FEMA approval for and is not qualified under FEMA, but we recognize as a need and recognize it as an area that we're going to continue to look at and have looked at over the last couple months, and then we'll continue to look at going forward.
Okay, so sorry, and just to clarify, so we do have FEMA approval vis-a-vis the like vulnerable adults who are under 65?
Yes.
Like folks with disabilities, unhoused.
I'd have to double check whether it's under 65, but I believe it's just vulnerable individuals above 65, but I have to double check for you.
Okay, you think it's still a 65? Okay, so it's like, so we know that the feds will support us in feeding children and seniors, but when it comes to just adults, like, and like
yeah, that is an area that has not been covered traditionally by.
Yeah, and that's where we really right now need the BRF and the care and CARES stuff.
And CARES, yep.
Yeah,
Exactly.
yeah, okay, but yeah, I just think anything we can keep doing to try to push in that direction is important. But those are all my questions. Thank you.
One thing I will just add, Councillor, is part of the resubmission that we'll be talking more about on Monday. Something that I know the council has pushed more on, in addition to the actual food and the process, is the coordination and logistics. I know is something that is near and dear to the council's heart, as we have added about $250,000 to the Office of Food Access to support their staff and operations as they continue this work going forward.
Yeah, no, and I think that's really important. I think there's no way to get food out to people without a major logistical operation. And I think we've seen a ton of staff get pulled into that from other places in the city because we don't have the staff capacity in regular times to do it at OFA. So yeah, I think that operating authority is really important. Thanks. Thank you, Justin. And thank you, Mr. Chair.
Thank you, Councillor Bach. Will be Councillor Asabi George is next, followed by Councillor Mejia.
Thank you, Mr. Chair, and thank you everyone for being here. I've tuned in and out of this and have not reviewed the slide deck from earlier, but I am curious if Justin could maybe give a quick rundown of what some of the eligible costs are. And I have a particular interest in what those costs are as they relate to our schools. And is there any, I understand that's a reimbursement piece. So is it stuck in FY20, or is it stuff that we could pre-order now and be invoiced for so we can get in reimbursed for FY21? That's my question.
Sorry about that. I was on mute.
No, that's okay. I know it's sort of quick. It was a quick question.
Sorry, I think the stockpiling thing is definitely a good one, something we're looking at in addition to the FEMA money, but also CARES money. We can't stockpile resources going forward, but it is something that we're trying to be strategic about. As far as the school funding, mostly it's been limited to cleaning our facilities for distribution as food. Obviously, with buildings being closed, there hasn't been a need to clean the buildings as regularly or as intensely as we are for some of our other public buildings. So that is certainly where we're focused on that. What we're submitting the $10 million for today is really focused on four things: the emergency shelter we've provided through Boston Health and some of our other non-congregate sites, PPE for public safety, BPS, and other city departments, which we're still active in the field right now. Disinfecting areas, so as I mentioned, BCYF and schools who are open for food distribution, as well as City Hall and other city buildings that are continuing to be open are getting more robust cleaning. And then finally, the emergency operations center that we've had to stand up, and the public communication and public 311 information we've had to put out there are all FEMA eligible, and some of the types of costs that we're pursuing.
On the PPE piece, are we purchasing with some bulk purchasing in mind from a statewide or some sort of regional approach as opposed to just as a city? And I'm sorry, is that something that we could stockpile? Because I know as someone who spent the last couple of months making almost 7,000 masks, we have started to hear from some different communities about needing masks for the fall, childcare facilities and some other programs. I wonder if we're prepared in that sense, if school were to reopen, which is certainly my hope. If children are going to be required to wear masks, are we prepared to respond to that? And is that something that we could get to now, thinking about the spending on PPE?
Yeah, no, it's a good question, and I'm trying to be mindful that it's all future looking on the reimbursement side. So I think between a combination of FEMA and CARES, we are preparing the schools to have the PPE that they need. One thing I will throw out there is the guidance I think we've heard so far is that masks will be required certainly by kids, and we want to make sure we have the supplies, ample supplies to provide it to students who need it. So I think that through a combination of FEMA and CARES Act funding, I think we will have the PPE necessary to open schools. What that resource is, I think, is we have to be a little bit strategic on, because we want to make sure we're maximizing FEMA where we can and where we're maximizing the other funding that we may have. So yes, I think we share a very sympathetic approach to having enough PPE going forward. We've been blessed to be able to get enough PPE for our frontline workers right now, and that'll be the goal going forward. Where that money comes from, though, will be a little bit of an evolving process.
Yeah. And what about the bulk purchasing? Are we purchasing as a city, as sort of a single unit, or are we looking to coordinate purchasing with other cities and towns, or as a bigger region?
So it's a good question. There's a lot of dynamics going on with PPE purchasing, both from a federal and state level too. So we have been purchasing most of our PPE on our own. We have a fantastic procurement office who has been able to source PPE from all across the world. I think it's a great idea to look at potentially bulk purchasing, and certainly purchasing to get more bang for our buck. But so much of the market is controlled by the federal government and then the state government, is that we ultimately end up coordinating a lot with NEMA and FEMA about the actual distribution of it, because we may put it in order for masks, and it may be redirected to the feds or maybe redirected to somewhere else, just because we're not the federal government. So I think we are mindful that is the approach that we want to be taking about bulk purchasing. We are certainly doing our own bulk purchasing of buying as much as we can when we find a sustainable resource, a sustainable supply line to access. But because of the sort of the overarching federal, state, and then local governments buying it sometimes doesn't lend itself to partnerships amongst everyone.
Thank you for that. Thank you, Justin. Thank you, Mr. Chair.
Thank you. And our final, on the first round, Councillor Mejia, if you have any questions. Looks like we are concluded, unless anybody has questions remaining, you can raise the blue hand. I'll give a minute for that. If anybody has any second round questions. It looks like Councillor Flynn. So I'll go to you, Councillor Flynn. There you go.
Thank you, Councillor Arroyo. And I just wanted to follow up, you know, if there was a second wave of COVID-19, I would like to see how we can do an after action report maybe on this response to see what we did well and some of the challenges, but to use that document to assist us as we go forward if there is a second wave coming. So wanted to ask your thoughts about that, Justin.
Hey, Councilor. No, I think that's a great idea, and I think it's something that we're actively working on through our EOC. I think it's something that they traditionally do anyways. Anytime the EOC is activated, we do after action reports, you know, mostly related to snowstorms or related to other areas. But I think it's certainly something we'll look at. I think we're also still very mindful that we're still in, you know, COVID-19. So while there may be a surge later in the fall, we're still actively trying to maintain the same level of operations we had during the first surge to make sure we're being as responsive to our residents and protecting their health as much as possible.
And my final question, what was the biggest challenge the city of Boston MEMA had during this pandemic?
That's a great question. I'd have to defer to Chief Benford and the entire emergency operations group to answer that fully. I can say from a financial perspective, I think Councillor OMalley said it best when there was just a real lack of leadership at certainly the federal government when it came to supplies and sort of purchasing PPE, especially that trying to source PPE even as a city of Boston with a relatively large budget was still very challenging in the height of the pandemic. So I would certainly say that was a challenge from the financing point of view and the A&F point of view, but I would have to defer on the operations side to the folks who are a little bit closer to the groundwork.
Did is the budget adequate for MEMA right now, the city budget for MEMA?
So the city Office of Emergency Management has mostly been funded by federal grants throughout the years, mostly coming out of obviously some of the work that they've done with the UASI program, which is a regional coordination group. It is very much a group that is designed to work across departments and across agencies, especially with the state and federal government. So the majority of their funding does come from the federal government. With that said, we have increased their budget the last 2 or 3 years, at least since I've been here, to give them more capacity to fund a couple more positions and a couple more projects and policy items that they wanted to pursue, especially around, you know, before this, we were focused closely on climate resiliency and flood resiliency that they were working on, in addition to just better general coordination amongst departments on emergencies. And I think that we are sort of growing that budget as we can, but you know, given the majority of their funding does come from the federal government. So I think it is something we're working on growing, but it has always been sort of set up and designed as a federally funded program.
And how many city employees work there?
I apologize, Councilor. I'll have to get back to you on that. It's a combination of city funded employees and grant funded employees, but we can get you the breakdown.
Thank you. Thank you, Councilor Royal.
Thank you, Councillor Flynn. And with that, I believe this hearing can conclude. If you have any final statements, Mr. Starrett.
No, thank you, Councilor. Thank you for having me.
Thank you. And with that, this meeting is adjourned. Thank you.
Thanks.